Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, a daily cranberry drink or the intake of cranberry capsules or tablets has been shown to reduce the risk of recurrent urinary tract infections in a large meta-analysis study published in the journal Federation of American Societies of Experimental Biology in April of 2017. You know, recurring urinary tract infections is one of those nuisance conditions that can really play havoc with your quality of life. And they're much more common than people realize. In fact, 1 in 2 women develops a urinary tract infection during their lifetime, and 20 to 30% of women go on to have recurring urinary tract infections, which can be triggered by intercourse or other sexual activity, but are also common during pregnancy, in patients with diabetes, multiple sclerosis, a history of kidney stones, stroke, spinal cord injuries, or any condition that affects normal urine flow. As well, the use of a catheter or a weakened immunity also greatly increases the risk of urinary tract infections. So urinary tract infections, or UTIs as they're called, are considered to be the most common bacterial infections seen in clinical practice in this part of the world. Now, in the United States, UTIs account for nearly 7 million office visits per year and 1 million emergency department visits per year, resulting in 100,000 hospitalizations each year. Now, for pregnant women, urinary tract infections can pose an important risk to the mother and the fetus, and pediatric urinary tract infections can also become quite serious. For most adults, urinary tract infections are successfully treated with antibiotics, but in some cases, it can move up the urinary tract and infect the kidneys, that's serious, and or spread into the bloodstream, causing life-threatening sepsis. So the large 2017 meta-analysis study on this subject, I feel is actually very important. If you can prevent recurrent urinary tract infections from coming back like that, that's improving quality of life and decreasing risk of possibly some serious outcomes. So here's what happened. In short, data from about 1,500 women indicated that daily cranberry intake reduced recurrent urinary tract infections by 23%, as presented by researchers from Tufts University, UCLA, and also Biofortis research at the Experimental Biology 2017 event in Chicago. Now, they stated that limited data from subgroup analysis suggested that cranberry was more effective when taken in the form of a cranberry capsule or tablet, where you're more likely to get a more concentrated dosage of the medicinal ingredients. However, a recent study involving the consumption of a cranberry drink, 250 milliliters per day, showed a 27% reduced risk of urinary tract infection recurrence in women who were recently treated with antibiotics for a urinary tract infection. So over the years, it's been shown that certain ingredients in cranberry and in cranberry extract capsules and tablets can reduce the ability of the E. coli bacteria from adhering to the walls of the urinary tract. This makes it easier for you to eliminate these bacteria from the urinary tract during urination. However, if you have a urinary tract infection, it's important that you get it treated with an antibiotic prescribed by your doctor. Cranberry products appear to help prevent the recurrence of urinary tract infections, but they can't actually treat a urinary tract infection if one occurs. So the takeaway message is that if you're prone to urinary tract infections, then using a cranberry drink or a supplement that contains cranberry extract each day may be a prudent way to help prevent the onset of future urinary tract infections. So I've provided a link to the 2017 studies below, as well as a link to other supportive research on UTIs that you might find helpful. So thanks for watching, and I'll see you next time.